for one of the heavy hitters of the fungi, Candida albicans. This sketch is jam-packed with information, so go through it carefully. Candida is one of the most heavily tested fungi, so you're more than likely to nail at least a few questions from what you're about to see. For our setting, Candida sounds a lot like Canada, and albicans comes from the word alba, which means white. So we're going to make our scene a snowy backdrop in a typical Canadian town. Or at least how we envision a typical Canadian town, eh? My apologies to all Canadians out there if it sounds like I don't know what I'm talking about. I'm sorry. Anyway, here's a playground in Canada with a Canadian flag. And now we'll cover it with some snow. And with that, let's start with some general characteristics. Candida causes both cutaneous and systemic fungal infections. In fact, it's the most common cause of opportunistic mycoses. If you have a patient who's neutropenic, has HIV or AIDS, or is diabetic, and all signs point to a fungal infection, you should definitely have Candida on the differential. Like the other systemic fungal infections, Candida is dimorphic. However, unlike the other systemic fungi, it goes against the adage, mold in the cold, yeast in the heat. Instead, it forms pseudohyphae and budding yeast at 20 degrees, which is cold, and germ tubes, which are hyphae, at 37 degrees Celsius. Once again, we'll remember the fact that Candida is dimorphic using our recurring symbol for dimorphic yeast, the dimorphic butterfly. To help you remember the different specific forms of Candida at what temperatures they occur, we have two different parts of the sketch. In the back right, we'll draw in a snow cone booth with the business name 37 Flavors. Let's zoom in here so you can see what's next to the 37. Notice we have a degrees sign here, and we've kind of made it look like a snow cone. Now check out the snow cones themselves. Notice they all come with a straw, which together looks like a cell and germ tube formation. So putting this all together, we have 37 flavors. We'll remind you that Candida forms germ tubes, or true hyphae, at 37 degrees. Okay, now further in the foreground on the right, we'll draw in some nice local Canadian shrubbery, with a bunch of segmented branches coming out that look like pseudohyphae. We have a thermometer next to it showing 20 degrees, and we'll add a stash of snowballs that look like yeast cells. So putting this symbol together, you should remember that at 20 degrees Celsius, or in the cold, Candida is in the yeast form with pseudohyphae formation. This is in contrast to the mold that it forms with germ tube formation in the heat, or at 37 degrees Celsius. And that's how you can remember these different forms of Candida at different temperatures. Hopefully you'll never forget it. Candida is also catalase positive. Yep, you just heard me correctly. I said catalase positive. You might have thought you'd left catalase behind with the bacteria videos, but nope, it's coming back again. Remember, catalase is important because people with chronic granulomatous disease are especially susceptible to catalase-producing organisms. We'll add our catalase-positive cat here to help you remember this. In regards to transmission, Candida is normal flora of the GI tract, including the oral cavity, and it's present in up to 40% of the population. But as long as the host is immunocompetent, it doesn't usually pose any problems. Since it is part of the normal flora in such a large percentage of the population, it commonly contaminates sputum cultures, so be sure to watch out for this. I doubt you'd see a test question on it, but it may come up on your clinical rotations. Just because it's there doesn't mean it's causing pathology. Okay, enough about that. Let's move on to the various clinical presentations of Candida when it actually starts to cause problems. Candida can present in several different populations as several different etiologies, most of which we'll try to illustrate in this drawing. So let's start in the back. Here we have a crying baby in a red swing. Is he crying because his mom abandoned him? No, he's crying because he has severe diaper rash. Notice we made the swing red to indicate the severe redness that you'll see in the diaper distribution, since this area is exposed to such heat and humidity. Moving along, we come to this old man with a cane and this boy, who are going to illustrate oral candidiasis, which can actually present in any age, but generally it's seen in the immunocompromised or in those who use steroids. The old man with his cane, of course, represents immunocompromised. Not sure what he's doing at a playground. Hopefully he has a grandchild here, or else that would be kind of awkward. Anyway, look at the young boy with the white, fluffy snow on his tongue. Notice he isn't immunocompromised, but he does have a blue inhaler in his hand, which in this case contains inhaled steroids. If people don't wash their mouth after using inhaled steroids, they can develop oral candidiasis. Another thing to know about these white patches that form in the mouth is that they can be scraped off. This is in contrast to leukoplakia, a precancer which looks a lot like candida. However, leukoplakia can't be scraped off. To remind you of the scraping, we're going to have a responsible adult in the back here who's shoveling snow. Notice we've also added a container of salt with her, labeled KOH. Salt is useful to have when clearing snow, and KOH is useful to have when prepping these scrapings to aid in the diagnosis of candida. So candida can infect just the mouth, or it can extend down into the esophagus, causing candidal esophagitis. This is most commonly associated with people who have AIDS and is known to be an AIDS-defining illness. To help you remember esophagitis, check out this cartoon animal with his mouth open and splotches in its mouth. If you look at the connecting tube slide, it kind of looks like an esophagus, right? And if you look at the base of the slide, there are white patches of snow. These white patches of snow represent the white pseudomembranes, or patches caused by candida. Knowing that esophagitis is an AIDS-defining illness will be hugely important. As with most AIDS-defining illnesses, it also helps to know at what CD4 count you begin to be at risk for developing illness. For candidal esophagitis, you start developing it at a CD4 count of 100. So we'll add this sign on the esophagus slide that says max of 100 pounds. Instead of pounds, think of CD4 count of 100. This is perfect because slides are obviously built for kids, and a good weight to differentiate between kids and adults would be around 100 pounds. 200 or 400 pounds wouldn't really make sense because those would be some huge adults that you're letting on the slide. So this should really help you remember the number 100. Again, this means that a CD4 count of 100 or less means that the patient is susceptible to candida esophagitis. Alright, now let's move on to this school teacher. We're going to draw her here on the left, getting hit in the crotch by a snowball from this pesky asthmatic kid. And why the crotch? Well, she's going to represent vaginal candidiasis. In the process of getting hit, she's dropped her bag and all of the stuff is fallen out. And on the ground you can see that she had prescription pills, birth control, and a jar of candy. Do you remember seeing this jar of candy somewhere else? Yep, this dates back to Pseudomonas and it represents diabetics. So diabetes predisposes people to candidal infections. These prescription pills, which represent antibiotics, and these birth control pills are both examples of things that can predispose women to getting yeast infections. Let me first delve into why antibiotic use can be a predisposing factor. Antibiotics kill bacteria, including vaginal microflora, which then allows candida to flourish. However, remember that candida does not change the pH of the vaginal secretions, unlike Gardnerella. Normal vaginal pH is acidic, around 3.8 to 4.2 pH, so we're going to represent this by a sign that says playground open until 4 pH. Yeah, I know it should say 4 p.m., but maybe they spell things differently in Canada. Anyway, that should remind you that in Canada land, parks aren't open after 4 p.m. And in women, candida infections don't happen after 4 pH. If you're a sketchy master, which I hope you are, you know that we like making connections between our videos. So let me pull up the Gardnerella drawing. You see here that we have the price of these plants, say 4p and up, representing higher pHs, versus here in Canada, the park is closed after 4, so there's nothing after 4 pH. So all this candida fun is happening below 4 pH. So remember this contrast, and you'll remember that candidal vulvovaginitis is common in diabetics and in women who use antibiotics or birth control, but it does not change the pH. Our last clinical manifestation that you should be aware of is that candida is an important cause of endocarditis. So let's draw a roof on this slide and draw some hearts on it to represent endocarditis. Candidal endocarditis is commonly seen in drug users. And what happens is candida is often found growing in certain types of heroin, which when injected IV can seed heart valves. The first valve it would encounter is the tricuspid valve, which is why it's so commonly infected in IV drug users. Notice we've made these roofs shaped like 3 pyramids. We did this as a callback to the Staph aureus video, in which the 3 pyramids represent the tricuspid valve. Same goes for here. IV drug users are at increased risk for developing candidal endocarditis, which commonly affects the tricuspid valve. My guess is that after watching all these videos, you can probably guess what the treatments for candida will be. Yep, azoles for the minor infections and amphotericin for the severe disseminated infections. So let's throw in some pine cones for conazoles, and we'll have them surrounding this teacher. You can also see a pine cone in the crying baby's hand here in the back, which is definitely an appropriate treatment for diaper rash. And we'll add some frogs, or amphibians, to represent amphotericin. Notice these are next to the immunocompromised man because immunocompromised patients can get disseminated infections and need amphotericin to be treated. However, we're also going to be adding a couple more drugs. One drug, which is specifically for oral or esophageal candidiasis, is called nystatin. Nystatin is a liquid which can either be taken as a swish and spit or a swish and swallow, depending on where the infection is. To represent this, we have this sign that says, "Play nice." Yet another spelling error at this institution for molding young Canadian minds, but it's meant to remind you of nystatin, which is also spelled with a Y. Nice, eh? Our second drug, which can be used in addition to amphotericin, is used for disseminated infections, especially for resistant candida, and it's called capsofungin. Not really a highly tested concept, but you may see it on rotations, especially in the ICU. To illustrate this, we're drawing a winter cap on the immunocompromised man. Again, this cap is for capsofungin. And that just about wraps up candida. Kind of a chaotic scene, but it has a lot you need to know for your exams. So watch it again, or if you're good, let's move on to our next video.